of his state of health today. Please join me to welcome Mr. Jimi Olaghere.
Hi everyone. It's really good to be
Mr.
here.
Jimi Olaghere, is he online? Can you just put him online?
Hey
Thank
everyone.
you very much. You're most welcome. Mr. Jimi Olaghere, a round of applause for him. He's a survivor. So he
Thank
wants
you.
to relate experience to us as regards this CRISPR technology. Thank you. Please, you have the floor.
Thank you for having me. Can you guys hear me? All right, sounds like it. So I'm here to quickly share my experience going through CRISPR-based gene therapy for sickle cell disease. I was diagnosed with sickle cell disease at birth. As most of you know, coming from Nigeria, West Africa, Sub-Saharan Africa, anywhere there, if you're diagnosed with sickle cell, well, if you're not diagnosed early, the prognosis turns out to be pretty drastic. Anyone that's born, not anyone, but a good amount of the patient population, if you're not diagnosed early, you tend to have this stroke at the age of 5, and that really controls where your life goes. It really starts to become a really serious problem if the disease is not diagnosed early. And I was fortunate enough to have parents that wanted to make sure that I was diagnosed before birth. And the reason because of that actually is my parents, my mom is from Ondo and my
Yes.
dad, sorry, my mom's from Ondo and my dad's from Edo. And back then, when you have a child, you think you're going to have a child with sickle cell disease, the next course of action is to actually have an abortion. So that was actually the plan for me. My parents flew all the way to the US to get this amniocentesis test to
Yeah.
confirm I would have sickle cell disease. And if I did have sickle cell disease, they were planning on doing an abortion. So my mom flew all the way to Washington, D.C., where her sister was living at the time. And they went on and had this amniocentesis prenatal screening test done. And they were supposed to get the results back in about a month, maybe 2 months max. But fortunately for me, they didn't get the results back as early as my mother would have liked. I remember she told me after she waited 2 months and didn't get the test back, the third month she called them, they told her the results and back. The fourth month she called, no results. Fifth, sixth, it got all the way till the seventh month of her pregnancy that they finally had the results. And because she was 7 months pregnant, there was no option to do an abortion anymore because it was just too late in term. So basically, because those guys really sat on their hands and or the test took so long to come back, that's one of the reasons I'm still here. So because it was way too late to have that abortion, and my mom being a woman of faith, she decided to give birth to me in the US, which I believe also saved my life. So we ended up back to Nigeria, Lagos to be specific. And it wasn't easy at all living with sickle cell disease. I remember playing football, always having to stop to drink water, to catch my breath, and just being that kid in the park that doesn't get picked. It took a toll on me. So that's when I realized that I was different, and I reached out to my mom. I went to my mom that day after school and asked, how come I have to drink water every time and I have to catch my breath? And then she told me that, I have this disease called sickle cell disease. And as mothers do, she put it very mildly. So when this disease started to get worse, I was actually quite unprepared. I remember what my crises were like in Nigeria. not having any access to narcotic pain medication back there in the early 1980s. It was just Panadol or paracetamol and a Vicks vapor rub. And my mom just, and my dad just massaging my back for hours throughout the night till I eventually passed out from the pain. And we'll just have that every other night. I remember I'll go swimming with my family, and I come out of the pool, all my joints are racked with pain, and we'll have to stop the party or swimming, and my sisters will have to stop swimming because of me, because I was in pain. We'll all have to go home. It was just really bad. Going to parties and couldn't blow a balloon without getting a serious backache and a crisis that would start the whole process again. So it was very difficult. Uh, so because I was born in the US, my parents thought it was a good idea to probably come back here and have access to a bit of a better, more medical system. And I eventually yet moved back to the US in my teens. And we were of the belief because we were moving to the US that the disease would be a lot easier to control and manage. And to some extent, that was true. The disease, we had more ways to modify we had more access to disease modifying therapies like hydroxyurea, which I didn't use in Nigeria. I think in Nigeria, the only thing I was taking was Agbo, which I hated. And there's no data on if Agbo is actually doing anything for you in terms of sickle cell disease. And when I moved to the US and we were expecting it to get better, like I said, although it was easier and we had access to other things that would help manage the disease, like blood transfusions, pain medication, hydroxyurea, the disease actually kind of got worse. It got worse. It was a lot more intensified. The pain were a lot more drastic and difficult to control. And I started having a lot of organ failure. I remember I had to have my gallbladder taken out, my spleen. Thankfully, I didn't have to have that taken out, but I was very close to, having that taken out about 4 hours. I was 4 hours from surgery before they told me that the size of my spleen has eventually gone down and let's wait 24 hours. And if it doesn't go back up, there's no need to take it out. I've had multiple bouts of pneumonia, acute chest syndrome, pulmonary embolisms. I've gone blind for 24 hours. I've had cardiac arrest. So moving to the US did not help as we had anticipated. In fact, for me at least, it felt like the disease had actually gotten quite worse. And, I kind of gave up hope. Sickle cell has a way of tying you down and holding you back, and just seeing the world move forward without you not being able to accomplish anything. I wasn't able to stay in school because I was constantly sick, so I had to constantly withdraw from my college classes. I wasn't able to work as much as I would have liked, which led me to entrepreneurship, which was helpful, but it was extremely difficult not being able to go in a career path that I had envisioned for myself. So I became, depressed, if I'm quite honest, and really jaded with life. And my parents could really see that. My family could really see that. And after that really bad cardiac arrest, I think that put me in the ICU for about 2 or 3 weeks. I came really close to losing my life, which had happened on occasion, but this one in particular just it felt kind of fatal for me, where I was done, to be honest. And I kept getting pushed, by parents and family. Let's do a bone marrow transplant, anything. I have three sisters, so that was where we started. We started with my sisters to see if any of them would be a match for me in terms of a bone marrow transplant. None of them were, unfortunately, but that turned out to be a good thing in hindsight. Then we tried for like a random stem cell transplant as well. And, there was no luck there as well. All of the options that we had come up with, I didn't have a half match. Basically, nothing, that was a dead end as well. And then finally, really at an attempt to really appease my parents and just get them off my back, I had been doing some research on gene therapy and sickle cell disease. And I had come to learn that there is a potential to cure a genetic disease like sickle cell with, some genetic tools that are being developed in the cell and gene therapy space. So I put a Google alert on gene therapy or gene editing and sickle cell disease, really anticipating I won't get any alert from Google probably for decades because for me, I really thought this was technology of the future. I mean, we joke around and I still call it, and some of the friends of ours in the industry, we call it Star Wars medicine. That's how far-fetched I thought it was. So I wasn't expecting to get anything back when I had done that research and put that Google alert on. To my surprise, about probably 5 months after that research, I got an article in my inbox about a woman named Victoria Gray, who was the first person to go through a CRISPR-based gene therapy in the world. This was in 2019. And 2019, I was actually in a different place in my life. Believe it or not, for the first time ever, I'd actually wanted to be alive because now, after 7 years of trying, I've finally been able to accomplish the goal of becoming a father. So I was a father now, or about to become a father, and all of a sudden, I really had to switch my mindset from not wanting to be here and being suicidal and whatnot to desperately needing to be here to take care of my son and my wife at the time. And yeah, I got really lucky that that article came to my inbox at that specific time. And I read the article, of course, and at the bottom they had the contact information of the principal investigator, and we reached out to him and the as before we knew it, we were flying out to Nashville, which was the treatment center for the clinical trial to see, and I live in Atlanta. So we were traveling there to see if I would qualify for the CRISPR-based gene therapy. Thankfully, I qualified. They do a series of tests to make sure that you're healthy enough, but at the same time, you have all these what they called eligibility criteria to make sure that you are eligible for a clinical trial of this caliber. And to my surprise, well, I wasn't actually surprised. I had a feeling I would qualify for it because I was, like I said, as you've heard, I was quite sick. I had, SS variation of sickle cell disease living in, at the time, New Jersey, cold weather state. So I was in and out of the hospital. So I had a feeling that, this could be something that I would qualify for, which turned out to be the case. And then in January of 2020, we started the process after I officially got accepted into the clinical trial. And, you know, the clinical trial was, for me, basically four main steps. The first step was really something they like to call keeping you on ice, basically keeping you healthy for the clinical trial through blood transfusions, blood exchanges, just making sure that you're healthy. And then the second stage is the collection phase where they collect the stem cells to edit. Uh, I had to go through four collections, which is a lot. And I'm not sure exactly why, but I know the scientists are trying to figure out why. I think that speaks to the lack of genetic diversity in clinical trials here in the US. We need people more from Africa participating in these clinical trials, particularly if they're sickle cell disease. And not just sickle cell disease, just clinical trials in general. We don't have a good representation of people of color in them. So, in my situation where I had to get collected four times, we have no idea why. And then the third stage was the conditioning phase, where your stem cells, where your bone marrow, I should say, you go through chemotherapy to wipe out everything, to make room for your new genetically modified cells. And the conditioning regimen that we used in this clinical trial was busulfan. I think I was on it for about 5 to 6 days, very intense. As you know, all the symptoms, they hit you about 2 to 3 weeks later, loss of hair, mucositis, mouth sores, basically, um, um, extreme nausea. And, it's very, very difficult. But, when I speak to other warriors and when they ask me how hard was chemo, I tell them it was extremely hard. But if you've lived with sickle cell disease, this is a hardness I believe that you can withstand. And then finally, the fourth stage, which for me was very anticlimactic after doing all that work to do the collection and to get where we basically are now, the infusion stage was very strange. After collecting all those bags of stem cells, they come back basically with three syringes of clear fluid, which to my surprise were my cells in just those three small syringes. And then they infused it to me in probably like 15 minutes. And that was it. Like I said, it was very, very anticlimactic. Um, and I think probably after 2 weeks of getting infused with my new cells, I started noticing a difference. For me, I've always had a baseline lingering pain with sickle cell disease. Even if I take pain medication, it still doesn't alleviate that pain. And I noticed that pain had started to kind of disengage, and the levels had been gone to virtually non-existent. And that's when I realized that, oh, this, gene therapy thing, I think it's actually working. I don't feel pain like I used to anymore. And that started everything for me. I've been through lots of emotions. It's been ups and downs. I'll be completely transparent. Gene therapy has definitely changed me. I feel like physically, I've seen the most change. I became the first person with sickle cell disease to summit Mount Kilimanjaro because I had gene therapy. Like I said, physically, I've completely changed. No more hospitals. I haven't been in a hospital for almost 5, 6 years. My eyes used to be yellow, now they're white. I can do things that I couldn't do physically before. No more pain. But mentally, it's not been it's been a struggle, if I'm honest. The change from having to live with sickle cell disease for I got the therapy at the age of 35, which is quite late in life for a chronic illness that you weren't supposed to live live past 10, and then it was 20. So 35 is quite late in life for sickle cell disease, at least the kind I had. Um, so the disease had basically built up who I was, and to all of a sudden lose that and having to figure out who the new Jimmy would be has been a struggle mentally. So those are some of the things that need to be addressed in gene therapy. There's still a lack of post-transplant support, at least a robust one. Also, the affordability issue has been a huge thing for me because after going through the transplant and finding out the way I found out about it, I wanted to make sure that I also did the same service and make sure that other patients living with sickle cell disease globally know about that transplant or this gene editing. So I went public with my story. Unbeknownst to me, the price of the therapy would cost $2.3 million in the US, and completely not available in sub-Saharan Africa, where I'm from, where I have cousins that have the disease. So that's been a struggle as well to be benefiting from gene therapy the way I have and know that millions of people are dying worldwide for a condition where we have two approved gene therapies that work fantastically has been a challenge to live with, if I'm honest. So that's why, my work comes in being a patient advocate and telling my story to make sure that these gene therapies are eventually going to get to the patient populations are in desperate need of them. So thank you. That's my story.
You're indeed a survivor. Congratulations. Yeah, thank you very much. A round of applause for him again.